Recent scientific studies show that most human beings have a misalignment at the level of the first cervical vertebra, called the atlas, which causes the center of gravity of the skull to shift, and, as a domino effect, the spine is forced to deviate. By doing so, the center of gravity of the spine extends to the joints, causing a myriad of discomforts, ailments, and physical and mental illnesses. Such diseases related to the nervous system include epilepsy, trigeminal neuralgia, vertigo, Apian syndrome, migraine, spinal deviations, scoliosis, kyphosis, lordosis, muscle contractures, vertebral disc deformities, scan hernia, spondylitis, spondylolisthesis, disc wear, system conditions, arthritis, rheumatoid, degenerative osteoarthritis, arthrosis, motor system blockages, multiple sclerosis, total, partial, and facial paralysis. Conditions considered as mental illnesses, schizophrenia, pressure-induced suicidal tendency. The cause of this atlas misalignment is under study, but it is currently presumed to be the result of fetal position, contractions, manipulation at the time of delivery, the subsequent adjustment of the atlas to the weight of the skull, poor postural hygiene, and muscle weakness, among others. In a single 40-minute session, the atlas will be readjusted to its natural position, automatically and gradually reorganizing the position of the entire spine, which requires time for its realignment. But immediately, patients notice an improvement in oxygenation to the brain, which allows them to have greater concentration, improve memory, and at the same time eliminate many factors that are generally attributed to stress. When the atlas is adjusted, decompression of the nervous system occurs, eliminating adverse sensations such as vertigo, migraine, and nausea. In the musculoskeletal system, improvements are perceived in increased mobility, improved posture, and the elimination of muscle strains. Later, progressively, along with the decompression of the nervous system, healing of the glandular and muscular system begins, leading to improvements in deeper conditions like ankylosing spondylitis, fibromyalgia, and arthritis. This improvement is also reflected throughout the circulatory system, improving blood pressure and increasing the level of oxygenation in the brain and in the musculature in general. As a final result of this entire process of physical regeneration, there is also a considerable improvement in the immune system, making the body much more resistant to diseases and giving it a greater capacity to heal itself. The Atlas E is not only the positional axis of the skull, it is also traversed by all the nerve connections that reach the brain, commonly known as the spinal cord. The spinal cord extends through the spinal canal along the entire column and branches into spinal pairs through the two lateral holes of each vertebra. This channel must be aligned among all the vertebrae to ensure that the spinal cord is not compressed at any time. When the atlas is dislocated, part of the bony mass of the atlas occupies the space that should be reserved exclusively for the spinal cord, compressing the nerve terminals, the arteries, and displacing all the musculature that should be supporting the skull. If this compression is maintained for a prolonged period, it results in all the previously mentioned diseases. When this imbalance occurs in the patient over the years, the body, in an attempt to rebalance itself, modifies the position of the spine, leading to conditions such as scoliosis, which worsens over time, causing more and more vertebrae to press on the spinal cord, triggering an increasingly noticeable degenerative process on the nervous system. This affects us as humans in multiple areas, as our entire being feels attacked in one way or another, with the announced ailments appearing to alert us, such as migraines, neuralgias, muscular thyroids, etc. All these are ways our body has to alert us about the general condition of the nervous system. The failure in the nervous system also degenerates, affecting the glandular system that regulates the hormones of our body and the immune system that serves as a shield against diseases, and our mood, which is deeply affected by the physical state of the body. Unfortunately, these discomforts become commonplace and we stop paying attention to them, until eventually our body fails in one way or another, resulting in the illnesses we already know. With this procedure, the repair of the damage caused by years of dislocation and pressure on the spinal cord, oxygenation failures to the brain, hormonal imbalances, glandular failures, and unmanageable and varied moods begins. The improvement in patients' quality of life is not the result of magical techniques, but rather the body's own ability to self-regenerate. Once the initial condition caused by the atlas misalignment is eliminated, the atlas will return to its original position, gradually restoring the balance of the spine, optimizing blood flow to the brain, and removing any blockages in the spinal cord's nerve connections. The benefits of these changes initiate a chain that extends throughout the organism, increasingly improving its general state and enabling the healing of previous ailments. Let's remember that all the nerves that control and coordinate the different organs of the body originate from the spinal cord. This is known as the parasympathetic nervous system, which is a vast network of nerves that manage each of the body's functions of which we are not fully aware, such as hunger or sleep. It also coordinates the organs by regulating the heartbeat and breathing, managing digestion, and coordinating the functioning of our pancreas, kidneys, and spleen. There are countless ailments arising from the compression of the parasympathetic nervous system, and since we are not aware of its functioning, we rarely perceive the problems between the parasympathetic system and the organs. Our brain naturally conceals all the body's operational functions from us and performs them automatically. This is a great advantage for us, as it prevents us from having to focus on our heart to make it beat or on our lungs to make them breathe. But it has the drawback that when a conflict exists, we do not perceive it immediately, but rather through vague discomforts and pains that we can hardly interpret. Another system in our body that is affected by the atlas dislocation is the glandular system. It regulates the production of multiple vital substances in our body, such as hormones, neurotransmitters, endorphins, and others. For proper functioning and development, it is required that these substances be produced and administered in the right and timely measure. As we already mentioned, spinal and circulatory compression severely affects this mechanism, leading to serious psychological and physical pathologies. When there are interruptions in the hormonal flow, everything from our mood to our reproductive cycles changes. If our neurotransmitters fail, our brain stops learning, fails to concentrate, and cannot rest. But not everything is negative. There is the great advantage that our glandular system recovers at an incredible speed, self-regenerating over the course of days, weeks, or months, depending on its severity, and it only requires us to eliminate the interruptions to help it operate correctly. As we had shown previously, these failures degenerate into severe discomforts or conditions and diseases for which the cause is almost never found and are treated only for their symptoms. It attacks the root of the endocrine problem by eliminating the complications caused by the atlas dislocation in a definitive way, allowing all the systems of our body to return to their original configuration. Remember that our body is not programmed to get sick. Our body has the ability to heal itself, and we just need to facilitate it.